Hi, I'm Dr. Armstrong. I'm going to be with you this semester in kinesiology. This is the first of what I hope will be a number of brief videos that will help supplement your reading and your studying. Some of these things are, or most of these things are items that I would be sharing in the classroom with you. Chapter 1, rather short, you probably could read it quicker than I can go through what I want to talk about at this point. We're going to look just a bit at the bones in terms of the types of bones. We're going to look at joint classifications, and then finally at planes and axes. So first of all, in terms of the bones, make sure that you pay attention to what the compact bone is and the cancellous bone. The compact is the outer hard layer, and the cancellous is the softer, spongier layer. If you were to take a cross-section of a long bone and look inside at the spongy, it looks almost like a honeycomb, and this gives it the weight to strength ratio. Pay attention, if you would, to a couple of charts in the text in terms of the epiphyseal closures, and it will show you the different lengths of years, the age at which particular epiphyseal closures will actually close. Types of bones: the long bones, short bones, irregular, the flat bones. Make sure that you can look at a bone and that you can identify it from its type. Now, one of the concepts that's going to be important for you to catch up front so that you can understand some things later on is the mechanical axis of a bone. And I'm reading straight from the text. A straight line that connects the midpoint of the joint at one end with the midpoint of the joint at the other, or with the midpoint of its distal end. Now, this is significant to us in terms of where the midpoint sometimes will fall outside of the bone itself, particularly in the case of the femur. And this will be important in terms of understanding the Q angle, which you will be looking at in a couple of chapters to come. Joint classifications. Please note that on page 5 of your text is a really important chart on joint classifications. There are 3. The synarthrosis is the joint classification where there is no movement basically at all. And a good example would be the sutures of the skull. Now, the skull is not one big head bone, but as you know, it has the sutures, and while these are not movable, they do provide some amount of shock absorption. Then there are the amphiarthrosis. The amphiarthrosis joint classification is also called cartilaginous. One of the examples of that is the symphysis pubis, where at the bottom of the pelvic bone, the two pelvic bones that come together, it's slightly movable. It's not meant to move, but in the case of an injury, a trauma of some sort where it comes apart or separates to some degree, that's where it's kind of a safety for the body. Finally, the diarthrosis, or the synovial joint, is what we are looking at mostly. It is where we have a joint cavity or capsule present in the actual joint. It's freely movable. It has synovial fluid in it. And there are different types of synovial joints. And there are good examples in the PowerPoints in regard to these types. Some of these you're clearly familiar with. For instance, the hinge joint, which is the elbow or the knee, the ball and socket, which is the hip or the shoulder, the pivot joint, which you may not be as familiar with. This is where you have the articulation of the ulna and the radius. The gliding joint, which you would find in the carpals and the tarsals. The condyloid joint, which is the articulation between the phalanges, and finally the saddle joint, which is pretty much unique to the thumb itself. Finally, planes and axes in this chapter. Now, there are 3 planes and 3 axes, and it sometimes helps to have a model to look at the actual planes and axes. And for that, I have this small piece of plywood, and I want you to think of this, if you would, as a plane. Okay, and there are 2 vertical planes, the sagittal plane and the frontal plane. There's 1 horizontal plane, the transverse. And then there are 3 axes. And the axis is always perpendicular to the plane. So if I'm moving in the transverse plane, for example, if I am doing an exercise like this is moving in the transverse plane, and it's moving about the vertical axis. Okay? Now, if I am moving in the sagittal plane, for instance, I'm doing curls, okay, notice how this is the movement in the sagittal plane. In the sagittal plane, about the lateral axis. Or if I'm in the frontal plane, for example, if I'm doing jumping jacks, that would be in the frontal plane. And it's in the frontal plane about the anterior-posterior axis. Now, it helps sometimes you could make something like this very easily out of cardboard if you wanted. And the reason that we emphasize the planes and axes, for one, is that in your paper, your movement analysis paper later on, in part 2, where you're giving a general description of the movement, you're going to want to describe the movement in as many different ways as you can for the reader. And one of those is by describing it through the use of planes and axes. For example, if I'm talking about, if I chose to do bowling, the movement initially is the sagittal plane about the lateral axis. Or if I'm talking about, let's say, I'm doing an actual, the exercise I described earlier. And how can I describe that in such a way that the reader gets that in his or her mind? It's in the transverse plane about the vertical axis, or longitudinal axis, if you will.
Okay.
Now, some final thoughts before I go. One is to keep up with your reading, if you would, and please stay current with the PowerPoints. Most of the chapters have 1 PowerPoint to go with it. Some of them have more than 1. If you have questions, ask. You can email me, you can text me, and that information is in the syllabus. And I want you to start thinking about your paper early. And the way to do that is for you to go online, go to Canvas, look in the module and the list of documents in terms of the paper, and look at the general instructions. And finally, look for frequent announcements from me. Thank you very much.